Friday's edition of COVID-19. There's been another slight decline in the daily tally, but authorities remain wary as cases persist in daily settings and across the nation. Against this backdrop, experts here are also looking into the possibility of mixing COVID-19 vaccines. We have details later on here. First is the broader pandemic coverage. Now, Suha, then, do start us off.
Sure, Sunny. For the second straight day, we are seeing a decline in daily COVID-19 infections, with 587 reported as of 12 a.m. this Friday. And with that, the number of domestically transmitted cases has dropped slightly to the high 500s, and we've got 16 infections from abroad. Now, new cases include 214 in the capital, Seoul, followed by 149 in Gyeonggi-do province. And in the rest of the nation, we are seeing single digits as well as double digits. Now, Jeju-do Island with 7 new cases has surpassed 1,000 cases in total this Friday. And with that, the total number of infections in the country stands at 138,898. And on this graph that we have the total number of infections in the country. And on this graph, we see that there hasn't been a big shift in the trend in the past week. And now, as for our vaccination updates, more than 650,000 people have received their first dose of vaccination yesterday, and that's the highest daily figure since Korea's vaccination program kicked off in late February. And inoculations are expected to pick up further speed, especially with vaccination for those aged 65 to 74 having kicked off just a day ago. And also, authorities are planning by July to administer jabs for the 50 to 59 age group, as well as high school seniors and elementary teachers for first and second graders.
Right. Meanwhile, so more than a dozen Korean COVID-19 patients have returned home from India here.
Yes, Sunny, that's 14 South Korean nationals who are dispatched workers at a Korean company in the hotspot of the coronavirus. And they arrived early this Friday at Incheon International Airport in a chartered flight provided by Aeromedical Service flying doctors. It was not an easy return, as difficult processes led to a 7-hour delay, and also one patient with severe symptoms faced critical moments during the flight. Upon arrival, that patient was immediately hospitalized, while the other 13 were sent to special treatment centers. Now, concerns over the Indian variant, meanwhile, are spreading to many corners around the world. In the UK, the recent new cases, some 75% are likely to be the strain from India. And also, Brazil is worried about the variant, with some saying that could lead to a third wave there. And Australia, the strain was also detected in Australia, where in Victoria State, a snap lockdown has been implemented. And now let's move on to the figures abroad. Here, India with 27.5 million infections, over a little less than 180,000 new cases were reported there. And then we've got the UK here with another rise of over 3,300 infections, of course linked to the Indian variant, as I mentioned before. And we've got resurgences in Argentina here, which has become the country with the 10th highest infections around the world, with over 41,000 new cases. And we've also got Iran having surpassed Poland's total caseload with almost 10,000 new infections. And with that, the total number around the world stands at 169.6 million. Those are the updates I have for now. I'll see you back after the briefing. Back to you, Sunny.
All right, so thank you for now. Right, let's now take a closer look at regional COVID-19 related news, starting with the online registration for surplus vaccines here in Korea that began on Thursday. For more on this, I have our Kim Sung-yeon here in the studio with me. Welcome, Sung-yeon.
Good afternoon, Sunny.
Right, so we touched upon this briefly on its first day, Sung-yeon. People can sign up for no-show or surplus vaccines for inoculation on the same day.
Right, the service was launched on Thursday afternoon, and it did receive a warm welcome from the public. Now, bookings have been made available on KakaoTalk and Naver, 2 of the country's most popular mobile applications. Now, anyone over the age of 30 who is not yet eligible to get a vaccine can make same-day reservations for surplus doses if they are available. The booking service on KakaoTalk and Naver are being supported by the KDCA, which is providing them with real real-time information on vaccination appointments and no-shows. The service generated a great deal of public interest, but there weren't many leftover vaccines to begin with on the first day, and the supplies quickly ran out. Moreover, services were interrupted for a few hours due to a server overload as people clamored to sign up for surplus vaccines.
We learned that Kakao had to reboot its servers due to too many people connecting at once after we launched the service at 1 p.m.
The system is aimed at minimizing the waste of vaccines from missed appointments and other factors. One AstraZeneca vial contains 10 doses, and once it's opened, any unused amount has to be discarded after 6 hours. The booking system will run for 2 weeks on a trial basis ahead of a full launch on June 9th.
Right. Meanwhile, Song-yeon, in neighboring Japan, I believe medical experts there are calling for the cancellation of the Tokyo Olympics.
Right. The Tokyo Olympics is set to take off in about 2 months' time, Sunny. And a top Japanese health expert warned on Thursday that holding the Summer Games could lead to the spread of new variants indeed. Now, Dr. Naoto Ueyama, chair of the Japan Doctors Union, said the IOC and the Japanese government had underestimated the risk of bringing tens of thousands of athletes, staff, officials, and members of the press into the country. Ueyama joins the growing rank of medical experts in Japan who have voiced their opposition to holding the Olympics. Another Japanese infectious disease expert also said the country is not ready to hold such a large-scale event, especially given the risk of the Indian variant in particular. Take a listen.
If there's an increase in the movement of people and close contact, when the outbreak isn't sufficiently contained, we could see a rapid increase in the transmission rate. We're expecting a further rise in the number of new infections, given the presence of the Indian variant.
Meanwhile, the IOC and local organizers remain confident that the Olympics and Paralympics will be quote-unquote safe and secure through extensive testing, strict protocols, and social distancing, with athletes set to be isolated at the Olympic Village alongside Tokyo Bay.
Now, in contrast, I understand China appears confident about hosting the Beijing Winter Olympics as planned next year.
Right, so China seems to be very confident indeed. In fact, 6 cities in China, including Beijing, may be nearing herd immunity already, with the country reportedly handing out a whopping 100 million doses in just 5 days. Now, just a month ago, the world's most populous nation looked to be falling behind in its vaccination drive, but the country's inoculation campaign has taken off over the last several weeks, and on Monday, China announced that it had administered 546 million vaccine doses, enough to inoculate around 20% of its entire population. China is now set to hand out 20 million daily shots, more than triple the rate from 1 month ago.
China's already set a world record by administering some 12 to 13 million shots a day. And if we have enough supplies, it's even possible to hand out 20 million daily doses.
If China can administer 20 million doses a day, the country could reach 1 billion shots in total by June, setting the country on track to fully vaccinate its entire population by the end of this year. At its current pace, China may also be able to vaccinate 70% of its population, which is the estimated threshold for herd immunity, in just 90 days. With that, the Chinese government is confident that it can successfully hold the Beijing Winter Olympics as planned after securing and reaching herd immunity before the Games kick off.
All right, Song-yeon, as always, thank you very much for the coverage.
Thank you for having me.
Right, up next, we're poised to join the regular briefing on the COVID-19 situation here in Korea for this Friday. Do seek to abide by prevention measures, both outdoors and indoors, to limit the risk of transmission, as cases, like we mentioned earlier, have been persistent across the nation and within daily settings. Also, do remember that those interested can register for no-show or surplus vaccines on the Naver and Kakao platforms for inoculation on the same day. Now, we're still waiting for the briefing to start, so let's take this moment to remind ourselves about the possible physical discomforts after COVID-19 vaccination. Common side effects include pain at the site of injection, fatigue, and headaches. Now, with regard to ways to minimize discomfort, here are a few natural remedies. Try applying a cold cloth or a pack on the injection site, or try gently moving your vaccinated arm to stimulate blood flow to disperse the local area of inflammation. For those suffering from fatigue, get some rest, and for fever, drink plenty of water. The briefing's about to start. We'll come back to you afterwards.
브리핑 설명이 있겠습니다.
Good afternoon, ladies and gentlemen. I am Kwon Junuk, and let me now begin our regular briefing for May 28th, Friday. First of all, here are our updates on the vaccine front. And nationwide, we have more than 11,000 hospitals nationwide, which are rolling out the vaccinations for those aged between 65 and 79. And yesterday alone, we have had more than 711,194 people receiving their shots. And among them, the first dose recipients is numbering at 657,192, which is the highest daily vaccination record since we rolled out our vaccines. And with this, we have vaccinated about 9.1% with their first dose. Moreover, as of yesterday, we also have had finished the AstraZeneca vaccine bookings for about 612,000, and for the senior citizens, we have about 64.5% of the booking rate, and we also will be having these bookings ongoing, and you can also do so by utilizing the PC or the mobile phones. You could also go to our KDCA website, and you could also make your booking for the vaccine appointments, and you can also do so through the call center at 1339 or even the local government's call centers. You can do so via the phone as well. And regardless of the registered residential address, you could also designate or book at nearby hospitals as well. And as for those over the age of 60, it is very important to note the vitality of the COVID-19. So we want to once again highlight that vaccination could help prevent the spread of the virus to your loved ones, and it can also protect your own safety and health as well. In order to protect your and that of your safety and that of others, please get yourself vaccinated as planned under these vaccination bookings. And also, it is very important to monitor your conditions even after inoculation. And if you have adverse responses, and in order to monitor these situations, we ask all of the recipients of the vaccines to stay at the hospitals for the next 15 to 30 minutes. And we advise you to return home and monitor your conditions for the next 3 hours as well. And it is very important that you need to keep the injected area clean and sanitized. And for the next 3 days after inoculation, you need to also have particular precautions. And if you have high fever or other adverse responses, you need to visit a doctor as soon as possible. As for senior citizens, you need to also enable them to be with other members of the family or other people so that they are not left alone after inoculation. You could also have swollenness or fever, a slight fever or headache or muscle pain or nausea and so forth. But remember that these symptoms are common symptoms after inoculation, which will fade away after about 3 days in time. And if you have any pain or swollenness in the injected area, you could mitigate the pain by putting a cold cloth over the area. And it is also advised to take painkillers if you feel the fever or if you have muscle pain as well. And as for right now here in South Korea, as for now, we ask you to take the painkillers because we have many forms of these painkillers that have been registered as regular over-the-counter drugs. You can also have increased acceptability for these drugs, and you could also ask your pharmacist or doctors for advice and take these drugs. And if you have allergic responses, or if you have a high fever above the 39 degrees, or if you also have symptoms that hinder your regular daily lives, you need to also visit a doctor as soon as possible for details. And if you have severe allergic reactions like anaphylaxis, you need to call 119, that is, immediately immediately or visit a nearby ER immediately. And in order to have a smooth rollout of the vaccines, we also have many vaccine doses arriving in South Korea as well. And as of yesterday, we also have more than 1.9 million doses of the vaccines that have been supplied. And we also have had 828,000 more doses. And right now, we have completed the supply of more than 14 million doses here in South Korea. And we also have 6.2 million more doses to be supplied until the first week of June. And in the year 2021, we have carried out the public nutrient survey, and we have seen the COVID-19 antibody rates. And we have carried out the survey at 16 cities and also provinces, and we have looked at about 2,000 people, and we have seen 6 people were tested to have positive for the antibody for COVID-19. And this shows that here in South Korea, we still have a very low level of immunity against the COVID-19. And this is largely due to a large PCR preemptive testing and also very proactive quarantine measures, which are also praised by our experts panels. And to this end, we need to reach and herd immunity through the vaccination. And until then, we need to carry out our basic quarantine measures like wearing face masks and having regular ventilation, and also keeping with other basic quarantine measures. Going forward, we will also continue these similar testings and surveys to see the rate of the immunity against the COVID-19 here in South Korea. And we also have a pan-government task force, and by each of the specific subcommittee, we have carried out detailed meetings for the vaccine development. We have listened to the vaccine developers, and we also have developed our standards and guidelines in order to help these companies and vaccine developers. And as for the development of mRNA vaccines, we have been also looking at the demands for these companies going forward. And we have also agreed to reflect these opinions and feedback into our plans and policies going forward. And here in South Korea, we will be also discussing, and we have already discussed, means to share and exchange our knowledge on the mRNA vaccine development. And going forward, we will also facilitate pan-government cooperation in these initiatives. And as for the COVID-19 treatments, the remdesivir drug has been administered to a total of more than 7,200 patients here in South Korea. And the regular treatment has been administered to about 3,700 patients here in South Korea across 76 hospitals. And as for the plasma treatment, they have been approved by the drug ministry for 47 cases. And last but not least, I would like to mention the following here. Globally, all of the countries are going and struggling against the COVID-19 pandemic, and they are overcoming these challenges. And they may be an exemplary model of quarantine. However, the next day, they could also witness a large cluster infection and a large increase of the daily tally. And this is also the case in Taiwan. And they are also having difficulties in responding with the medical capacity. And this also highlights the importance of vaccinating ourselves. And here in South Korea, as we roll out more vaccines, we will be able to significantly reduce the number of fatalities as well as critically ill patients. And we could also significantly reduce the frequency and the size of cluster infections here in the country, across the country. And to this end, we will also believe that we can have a manageable situation of the COVID-19 outbreak here in the country. Of course, everything depends on the reproduction rate of the virus as well as the number of vaccination rates. And as of now, if we also continue to have similar rates of outbreak or daily tallies, we believe that we need to also compare ourselves to the reproductive to other countries that have have higher reproductive rates, that is, and we believe that compared to them, we will able to reach a herd immunity at a faster pace. And of course, we need to consider other variables, including the short terms of the immunity against the virus. However, in the U.S., we have seen that the dominant strain that is the UK variant, and we also believe there could also have other variables. And however, we could also once again highlight that it is very advisable to get your shots as soon as possible if it is your turn to get the vaccinations. And the COVID-19 vaccines that we are administering to our public is the most safest and the surest way to, and it is definitely a key to return to a state of normalcy. And as we overcome the COVID-19 pandemic and as we return to a state of normalcy, we believe that this normalcy can also be maintained through the COVID-19 vaccinations that are developed here in South Korea.
네, 지금부터 기자님들 질문에 답변 드리는 시간 갖겠습니다.
Right, that was Kwon Jin-wook with Friday's afternoon briefing. So what did he have to say?
Well, first off, 9.1% of the nation's population appears to have been vaccinated now, at least with one shot of vaccination, with over 711,000 in total yesterday, including the second dose. And Kwon also mentioned that close to 65% out of the age group of 65 to 74 have pre-registered for vaccination. So still quite a large proportion is left. And also they should get their booking until the June 3rd. Because the vaccination for those people who did pre-book will be completed on June 19th. And Kwon also mentioned that people should not only check their conditions 15 to 30 minutes after getting vaccinated, but also for 3 hours they should monitor their health condition after vaccination. And he also had a message to the country saying that every country around the world is affected by COVID-19, and there are some countries that have been praised for their antivirus measures, but suddenly can become countries that are hotspots of the virus. So he also said that herd immunity may be achieved depending on various factors, such as the reproduction rate of the virus. And that is also why it is crucial right now to get vaccinated according to everyone's order.
Right, that is so true. All right, so thank you very much for that.
My pleasure.
It's time now for the final installment of our week-long series on the 5 arenas in need of global action ahead of the 2-day P4G summit starting on Sunday here in capital Seoul. In this segment, we highlight the importance of proper waste management to better protect the environment.
The world is struggling under the weight of its growing pile of plastic waste. And our planet may be covered by an estimated 1.3 billion tons of plastic by 2040, unless immediate action is taken. Creating a circular economy and thereby minimizing waste has been identified as a key objective by the P4G, precisely for this reason.
폐기물이 발생은 생산, 소비, 또 폐기에 의해서 우리 선형화로 이루어왔는데 생산하고 소비하고 다시 발생해서 재사용, 재활용을 하게 되면은 이것이 산업체로 들어가게 됩니다. 그 순환고리가 이루어지는 거예요. 그래서 경제성을 갖고 있는 비즈니스 모델을 포함시켜 갖고 누가 비용을 내고 어떻게 우리가 경제성을 확보할 수 있는가 하는 것에 우리 소비자, 또 기업체, 또 기관들, 정부 이러한 것들이 다 합쳐갖고 만들어내는 것이 순환경제라고 얘기해 줄 수가 있겠습니다.
A special environmental campaign is being held here today in the middle of Seoul. A joint endeavor between local firms and the Seoul city government, the campaign is aimed at promoting better awareness on the proper recycling of plastic bottles and encourages all citizens to take part.
어렸을 때부터 학교에서 분리수거를 해야 한다로만 교육을 받았었는데 분리수거를 하면 어떻게 되지? 라는 거가 최종적으로 어떻게 되는지 한 번도 본 적이 없는데 이렇게 가방을 만들고 이거 다시 사용하고 이런 거를 이제 눈으로 볼 수 있어가지고 좀 좋은 것 같아요.
For years now, Hyosung TNC has been using a technology that can extract polyester threads from throwaway plastic bottles. Unlike conventional polyester fabric that is made from petroleum, these threads are extracted from plastic bottles that are crushed into small chips, which are then used to make clothing and other fashion items.
마지막에 저희 가방 자체가 남는 공정이 실오락이 0.1g 정도도 안 남거든요. 그러니까 버려지는 거는 그거밖에 없거든요. 사실은 리사이클하는 그 투명 페트병 자체도 원래 첫 번째는 사용을 줄이는 게 첫 번째고, 줄이는 게 안 되고 굳이 우리가 필요에 의해서 사용을 해야 된다고 하면 그거를 재사용할 수 있는 방법, 그게 바로 리사이클인 것 같고요. 제작하는 방법도 제로 웨이스트에 가깝게 해야 조금 단계별로 다 완성될 수 있는 하나의 순환이 될 거라고 생각해서.
The fashion industry is one of the world's leading polluters, and the clothing that people throw away each year accounts for more than 80% of all textile waste, which are then buried or incinerated. Only 1% of the textile waste ends up being recycled, highlighting the need for more sustainable changes in the fashion industry.
우리가 자원순환 쪽으로 우리가 신경을 많이 쓴다면은 우리 소각하는 양을 최소화할 수 있고 소각된 재를 다시 재활용할 수 있고요. 그것을 이제 매립도 가장 많이 줄일 수가 있어요. 그래서 소각하고 매립을 최소화하는 개념이 우리가 쓰레기 없는 제로 웨이스트 소사이어티라고 얘기해 줄 수가 있습니다.
Climate change has also brought changes in the way that businesses operate, and companies are now wary of their carbon footprint, as consumers have become more environmentally conscious than ever before. Going green is no longer a sunk cost, but an investment that can determine the fate of a business. Through discussions on these agendas and more, Korea is looking to build a climate action legacy of its own as it hosts the second P4G summit.
국내 아스트라제네카 백신 접종자들에 대해서 화이자 등 교차 접종 임상 연구를 진행할 예정이 있습니다.
In response to shortages in supplies and concerns over side effects, relevant authorities have been exploring the option of mixing and matching COVID-19 vaccines, as well as extending the dosing interval. Now, for more on the efficacy of these efforts, here in the studio, I have Professor Sarah Okshin from Korea University. Welcome back, Professor Shin.
Thank you for having me.
Meanwhile, joining this session virtually is Dr. Son Ho-jun at Johns Hopkins University, who is currently in Daegu. Good to see you again, Dr. Son.
Thanks, Sunny. Nice to see you again.
Right. And I also have Professor Paul Moss at the University of Birmingham joining us live as well. Pleasure to have you with us, Professor Moss.
Lovely to be with you this morning. Thank you very much.
Right then, Professor Shin, we'll start here. Preliminary results from a trial in Spain reportedly showed the benefits of combining different COVID-19 vaccines. Could we start perhaps with the results of this trial?
Yeah, so this is a preliminary results from a trial of about 670 people under the age of 60 from Spain. So they have given the AstraZeneca vaccine first, and then the Pfizer vaccine as a booster. And it has led to a very robust immune response against the COVID-19. And they have also found that, the presence of neutralizing antibodies increasing over 7-fold than the doubling effects of having this AstraZeneca as a second shot. So this is very interesting results and quite amazing actually. And this data suggests that mix and match vaccination against COVID-19 could create, a robust and more potent immunogenicity as a vaccine. So I think it's very interesting data. Yeah.
Right, which is why, Dr. Sohn, similar studies are currently underway in the UK, Italy and Russia, just to name a few. Now, how do you explain the growing interest in mixing and matching COVID-19 vaccines, Dr. Sohn?
Yeah, Sunny. So as Dr. Shin has put it, these vaccine mix and matching, or another way to put it is a heterologous prime boost of the vaccination, is to give us ability to administer different type of effective vaccines at a different schedules and mix and match. And primary reason that we people have been studying this from the very beginning is that, as you know, vaccine development and productions are very challenging. And we know that the supplies are always fluctuating. And right now at this point is really low compared to the high demand. So having alternative vaccines that can be administered heterologously gives a lot of flexibility to vaccination programs and also people to say that they're not restricted to a specific type of vaccine. So that's the primary purpose. So this has been, again, I think it hasn't been a recent effort. It's been thought from the very beginning, and other earlier vaccines such as the Ebola vaccines and SARS, earlier other diseases have been doing these types of research from a long time ago. So it's not a brand new thing to discuss.
Right. Meanwhile, then, Professor Moss, how safe is the strategy of combining COVID-19 vaccines that are based on different technologies?
Yes, this makes a lot of sense in many ways, really, as Dr. Ho-Jun says, because our vaccines are inducing an immune response against the spike protein. Of course, all the vaccines have that as their dominant protein, and really all you're changing is the vector, the way of delivering the spike. And in many ways, there are some reasons to think why this would be sensible, because the new challenge to the immune system of seeing another type of vaccine may stimulate it somewhat more and develop a stronger immune response against the spike protein. So as well as the important options such as availability and so forth, that may actually make some scientific sense. I suppose the concern has been some of the side effects, and I don't think we've seen many of those to date. But one thing that has been mentioned is in the UK, when we've started to mix these vaccines, we've seen some mild side effects. The ComCov study here, we found 10% side effects, mild things like headache with the standard vaccine regimen. But interestingly, that was increased to 34% when we mixed AstraZeneca or Pfizer in the UK. But these are mild symptoms. These are things like chills, fatigues, headache, and they pass off very quickly. I think what will be interesting is to see whether that translates into a stronger immune response, as Dr. Ho-Jun and Dr. Okshin suggest.
Right. Professor Shin, Professor Sohn mentioned that the blending of vaccines has also been adopted for other diseases. Could you tell us a bit more about this?
Yeah, so as Dr. Sohn has mentioned, for decades, scientists have tried this mix and match vaccination trials against a range of viruses such as HIV, Ebola, and influenza. But I don't think they have gone much far with as far as the clinical trials, just because these studies were almost done with animal studies. And I think there's few reasons for that, because when you think about those mandatory vaccines for the infants, we usually give like DTP or MMR vaccines like for multiple times for these infants. But we usually use the same vaccine. We don't combine two different vaccines because these vaccines have been used for a very long time and has proven to be very safe and effective. And so why, would you make a risk of changing the vaccines, right? So all these vaccines that we have been using, we didn't have a medical need to really experiment with mix and match vaccination. And also, for these vaccines, they have been made with the traditional method, just like using live or killed forms of viruses or bacteria. So they didn't really have multiple vaccine platforms that we have now, thanks to COVID-19 pandemic. So now we have so many multiple vaccine technologies to play with, and for some countries the vaccine supplies are not sufficient. So I think it's kind of right timing for scientists to consider having this mix and match vaccination a try. And I think it's a good thing for us to really learn from this COVID-19 mix and match vaccination, and we can probably apply this knowledge to other disease and other viral vaccines.
Right, indeed, there are many lessons being learned at the moment. Dr. Sun, I believe authorities here in Korea are also looking to conduct a similar trial of mixing and matching COVID-19 vaccines. What can you tell us about the efforts here, and what, Dr. Sun, is your personal opinion, that is, on the practice of mixing COVID-19 vaccines?
Yeah, so the Korea has, I believe, recently inquired starting of a trial where the AstraZeneca vaccinated people will be recruited to see if there's a way to mix and match, to study the effective mix and match of the Pfizer vaccine as a second, or Pfizer vaccine as a primary, and then the AstraZeneca as a secondary. And the number of patients I think they are trying to recruit is about 600. And I think this is it's an important area to study, and especially in our own population. I believe this will be one of the first of actual vaccination trials that's going to be done for those vaccines that are currently approved. So it's very promising and exciting to see this. And I think in terms of scientific evidence, we already know that these mix and match vaccination strategy can induce a much better antibody response, and also essentially conceptually on the scientific level, it potentially combines the benefits of the two different vaccines. So I think this is exciting to see the trials are being conducted. And this, if found to be effective, I think it will definitely ease the concerns for future supplies of the vaccines to meet the demand, and also improve how we could administer the vaccine, the logistics. We've seen a lot of news reports of accidentally cross-vaccinating, mixed vaccinating because patient didn't know the first vaccines, or by accident by the providers. But doing these trials will allow us to not only look at the effectiveness, but also safety. I think the challenge would be what kind of outcomes we're looking at in the trials. It's going to be a little bit more difficult because as we reach more people being vaccinated, fully vaccinated in the population, so recruitment is going to be very difficult thing as we see more people vaccinated. But we'll see how it goes. I'm very positive and looking forward to see how the study progresses and seeing the actual results.
Right. Meanwhile, over in the UK, Professor Moss, what is the current UK stance on combining COVID-19 vaccines? Because as seen in the video, France and Germany are permitting people who receive their first AstraZeneca shot to take a Pfizer shot as their second dose.
Yeah, in the UK, we are following the sort of registration data from the trials. So we are not mixing and matching for the general population. And as Dr. Sun says, we're really going through the clinical trials. There's Dr. Sun's trial, the one in Spain and the one in the UK. We're really trying to study the effect of mixing and matching to see whether there is indeed any benefit, and presumably certainly no harm from that.
I see.
And I think one of the important things for the future, of course, is there's a lot of talk about booster vaccinations, even after the first two vaccines. And so here we may well be looking at a different vaccine as well. But there's a lot of debate in the world now as to the longevity of the immune response after the vaccines. And indeed, there was some hope this week that longevity may be much better than we thought, with the induction of quite strong and robust plasma cells, as we call them, in the bone marrow, making immune responses. So if we do need boosters going forward, then that's another area where we may need to consider new vaccines.
Right. Professor Moss, I believe you partook in a study that showed stretching the dosing interval for the Pfizer vaccine boosts antibodies within the elderly. Could you tell us a bit more about your findings and their implications?
Thank you very much. Yes, it's a very simple question, really. Almost all vaccines depend on two separate vaccinations, and our study really just assessed the potential importance of the interval between those. And as you say, it was the BioNTech Pfizer mRNA vaccine, which in the registration trials was always 3 weeks apart between the two doses. But in the UK, back in, I think it was January, because we wanted to try and cover the population with one dose quite quickly, the government decision was made to extend that interval out to up to 12 weeks, which was all quite controversial at the time, to be fair. And we just studied how the immune response differed in people who had the Pfizer-BioNTech 3 weeks or 12 weeks apart. As Dr. Soon says, you have to measure the antibodies and also the cellular response. And what we found was when the vaccine was delayed for up to 12 weeks, the antibody response, the peak response to the second dose, was 3.5 times higher, which was, somewhat unexpected, really, and suggests a delayed second vaccine may give a stronger boost to the immune system, certainly on the antibody side. The cellular response was somewhat less impressive. In terms of implications, again, it might come down to longevity. If this gives a better set point for many months and years, and that would be very valuable and might even provide a greater protection against the viral variants. But we were somewhat surprised to see that.
I see. And Professor Shin, keeping in mind Professor Moss's findings, do you forecast a shift in strategy here in Korea with regard to the use of the Pfizer vaccine?
Yeah, so I was very impressed with Professor Moss's finding as well. Pfizer vaccine, messenger RNA vaccine, usually gives very good protection rate just with 3 weeks intervals, but even better results with 12 weeks intervals between the doses. So I think it's very impressive, and I think we have to consider his findings to be very significant. But since this has been done with a small-scale trial, I think we need to have more data with a large-scale clinical trials to see if this holds up, this positive results holds up for the large-scale trial.
Right, and staying on the domestic front, Dr. Son, as part of efforts to rally public support for the local vaccination campaign, authorities have unveiled a list of incentives, including an ease in the mask mandate for those who have received their first dose come July when outdoors. What are your thoughts on this, Dr. Son?
Yeah, so I have a bit of mixed feelings about this. I'm quite positive about recommending who are vaccinated and fully vaccinated, as they're protected so that they have the freedom to not wear a mask in the public, and especially outdoors, right? I think the recommendation is not for the indoor unmasking, so that's important to know. I think the people who are vaccinated up front, they should have that sort of a freedom, and I think it's one step into how we return to our normal lives without the masks. But we need to think about this in the context of everything. And we are following what U.S. is trying to do, which the CDC recently have recommended those who are fully vaccinated to not require masking outdoors, right? But in the U.S., the vaccination rates and number of people who have been vaccinated is much, much higher than South Korea. Of course, the number of people who are infected are also high in the U.S., but it means that there are more people protected out there now than those who are being infected. In the South Korea's case, we're still in the very early phase of vaccinating people. Of course, we're also we are one of the lower disease prevalence setting, which is very fortunate thanks to all of the public health response.
Right.
But I think we need to think about this, that there have been a lot of discussions around negativity about this unmasking, not wearing masks in the public if you're vaccinated, because it's very difficult to tell who's vaccinated and who's not vaccinated without some sort of verification. And in the public space, it's very difficult. And secondly, in a person level, when you're wearing a mask and you're not always staying outdoors, you have to go indoors at a certain point in time, and wearing the mask in some situation, not wearing the mask in another situation. We've all experienced we left the mask at home and had to go and buy new mask or go back home. So that kind of confusion can create a lot of problem in the midst of rising infection rates here in Korea. So we need to be a little bit concerned about and cautious about this recommendation.
Right. Dr. Son, thank you very much for your words of caution. And Professor Moss over in the UK, thank you very much for joining us live at this very early hour at your end. And Professor Shin here in the studio, thank you very much for your insights.
Thank you.
Thank you. It's been lovely to be with you.
Well, that brings us to the end of this edition of COVID-19. Cluster infections within daily settings, including places of work and worship, as well as dining and drinking, have authorities urging for strict adherence to prevention measures. Have a safe weekend.
Everywhere around the world, people are getting vaccinated to get back to normal life. South Korea and the United States have